Michael Tildesley, an Associate Professor of Life Sciences at the University of Warwick in England, joins us now. This is a country with 1.6 million people. How do you manage these numbers and the possible, call it tragedy, that we're looking at in September?
Well, of course, I mean, this is extremely concerning. And we remember India went into full-scale lockdown relatively early in their own epidemic. They went into lockdown around about late March. The difficulty and the challenge was they came out of full-scale lockdown relatively early in their own epidemic curve. Testing capacity was very low. It has since improved, but there is some way to go. And as we've seen from your reports, cases are still rising. So over the coming weeks, really, they need to keep putting resources into increasing that testing capacity. And of course, in the major cities, we may expect that cases could still rise. And in order to try to manage the disease long term, it may be that more stringent policies might need to be considered, such as local lockdowns, and really to hammer home the need to keep social distancing, because as we see from the cases, they are quite some way from the peak yet in India.
And the economy and the fact that you have so many people that their choice is either do I eat or do I stay at home? And they sometimes say, you know, I'm either going to die of coronavirus or of hunger. How do you respond to that tough dilemma?
And this is, I mean, this is an extreme, extremely worrying situation for India. I mean, we worry about things in my own country, but it's very much more kind of, we trade off public health and economic aspects. But of course, in India, there are so many more people who it is really life or death situation. And I think that's an extremely hard calculation to do. All that we can do as advisors is look at where we are in terms of the epidemic and suggest local measures to stop large waves occurring in these major cities. And I think really the government needs to do more to try to identify the really high-risk areas and potentially put in these local measures to try to curb spread of disease and prevent a large-scale public health disaster in the future.
And so do you think it's inevitable that we'll see a peak in September?
I think it's inevitable we will see a peak at some stage. It's difficult at the moment to predict whether that will be in September or slightly earlier or slightly later. And it really depends actually upon what the reaction is going to be in terms of if there are going to be the introduction of more stringent policies. If another lockdown is introduced, this could potentially delay the peak, perhaps flatten it slightly. But of course, we are still some way away from that. And relatively few people have been infected in India as a percentage of the population. So I think they're still in that situation, unfortunately, for some time to come.
All right, Michael Tildesley from the University of Warwick in the UK. Thank you so much.